Now, though, it's 9:14 and we do everything here. We can do it all. October is Breast Cancer Awareness Month, and we don't want to leave that out of the conversation this morning. We're talking about breast density specifically and the impact that it can have on your risks. And joining me to talk about it is Dr. Colleen Madden. She is the Division Chief of Breast Imaging at IU Health. And for those that don't know, first of all, good morning. Good to see you.
Good morning. Thank you for having me.
Absolutely. I know breast density is a big factor for a lot of people, and it can be a risk for the disease. Is that true?
Yes, it is. Yeah. So breast density, if you have dense breasts, breasts are either dense or not dense, and over 50% of women have dense breasts. And with dense breasts, there is an independent risk factor that you have for the developing breast cancer of 4 to 5 times the women who do not have dense breasts. And then also women with dense breasts, also because cancers look very similar to the density that we see in the breast, they can be obscured by the breast density. So there can be a delay in the diagnosis because of the appearance of the dense breasts, and then it's just harder to see things on the mammogram with the dense tissue.
Yeah, so, is that something that I feel like I should have known that by now? I'm thinking about all the reports that I've done for October and Breast Cancer Awareness Month. I'd never heard that statistic with that 4 to 5 times the higher percentage potentially for cancer with that type of breast tissue.
With that type of breast tissue. So, the state just passed a law along with the federal government requiring us to make sure that when you receive your mammogram report or information in the mail, that we have a statement that says dense or not dense. And then we just explain that it's important to know the density of your breast because we want to develop the best treatment plan for you. Your doctor may recommend additional screening such as ultrasound or MRI to completely evaluate the breast tissue.
Are there other factors that we need to know about besides the density of the breast?
Well, other risk factors would include it's a genetic issue. Not all women who have breast cancer have the gene, but it is hereditary. So that's another important risk factor. When people come in, we typically ask lots of questions about their family history, and then we put those answers into a model which tells us what their lifetime risk is, what their 5-year risk is, and what their 10-year risk is for breast cancer. Because we're trying to develop the best screening program for them based on their risk and their breast density.
We're almost out of time. I have about 15 seconds left. Is it still age 40?
We recommend age 40 every year, screening every year. And then I just want to say thank you to all of our breast center staff who work so hard every day to serve our patients.
Doctor, thank you so much. We appreciate you
and
all you do. To learn more, again, specifically about breast density, the impacts, fox59.com/links, and now something that you can make sure that you look for. Dense or not dense? And now we're learning the information.
Simple.
Okay, Jim?
All right, thank you.